My name is Jessa Grey, and I am a PGY5. It means that I've graduated from medical school 5 years ago, and I am a psycho-oncology fellow. My love of psychiatry really began in my undergraduate career. I majored in behavioral neuropharmacology, which is basically psychiatry, but at the time I didn't connect it to psychiatry. And then I started medical school thinking I was interested in the brain, so considering either psychiatry or neurology, and I just fell in love with psychiatry. The ability to connect with patients and really help people when their sense of self is kind of under threat, because that's really what the mental health is all about, is that it's so intrinsically tied to your identity. So I'm actually the inaugural Psycho-Oncology Fellow. So I'm the first one, and I'm very happy and excited to be able to create this new training pathway. Psycho-oncology is considered to be a part of consultation liaison psychiatry, which is basically the psychiatric care of the medically ill. And so psycho-oncology really fits that bill, but it's kind of just a whole other level of complexity, which is really what drew me in. I love really caring for people who have psychiatric needs in the setting of medical complexity. Since starting college, I think when you're young and inexperienced, you kind of go into a field thinking, okay, everything that we've discovered is set in stone, and maybe there's not that much that I could potentially contribute to it. But learning about the human mind over a long period of time and understanding that we really have only scratched the surface of our understanding of neuroscience, mental health, neuropharmacology, all of these elements that still really have a lot to be discovered and unearthed about them. And I find that that is really exciting to feel that sense of I could really contribute in a meaningful way to this field. Very fortunately, this is something that I was looking for in a fellowship program when I was interviewing all over the country. The University of Washington and Fred Hutch really puts a big emphasis on our emotional well-being, knowing that we're, dealing with some very heavy stuff when we're seeing our patients. So that, just merely having some time to exercise, eat well, all of the things that really are important to your overall well-being, but are easily pushed by the wayside when things get busy. So that's a really nice feature. I find myself really relying on family, pets. I have one dog. She's a 10-year-old Labrador. She's sweet and she's wise, and she's very sweet with my 2-year-old. All of those close social connections that can be really helpful. Physical activity is certainly something that helps me as an individual and helps many other people. I try as best as I can to do that. And I was always told that Seattle can be hard for people with their moods in the winter time. But what I've noticed is having that kind of mindset of the sunlight that we do get is precious. Anytime the sun is out during the day and I have a moment, I'm all about getting out there and getting just a little bit of sun exposure. And I think that kind of shift of this is a precious thing that I have to take advantage of when it's present has really made it more special and more impactful. From my experience thus far in my fellowship, I noticed that the patients who seem to be struggling a little bit more are often very socially isolated, which of course is really hard if you don't have anyone in your life. But a cancer diagnosis does have a tendency to kind of shift perspective and to place certain levels of importance on various things in our life. And so I do see that it provides an entry point to reestablish a relationship or rekindle something that was previously there, which I find really helpful for my patients. I would also say that a lot of the time I see patients who do have mood problems and mood symptoms in the setting of their cancer treatment, intractable nausea, fatigue, brain fog. All of these things are very real symptoms that are well established in the literature as being consequences of treatment. Having the knowledge and the foresight that a lot of these are not necessarily permanent, and then also being able to talk really freely with your oncology team about what you're experiencing and the impact that it has on your day-to-day life and your functioning. That is a really important thing, and something that I am really glad that I've seen at Fred Hutch is how willing the oncology team is to make adjustments as needed by patients. So acknowledging that those symptoms are real and that they're very hard and that there are things that can often be done about them. When we see people who have that level of hesitation or start to pull back from an existing relationship in the setting of some bad news, in my mind, it often says much more about that person who's doing the pulling back than it does about the person who's being pulled away from. It might be their own experience with someone they loved getting a cancer diagnosis. It might be just fear, but having that kind of perspective of it's not me as an individual, it's them, their experience with things in the past, their reaction. So taking a little bit of that kind of self-blame away that can certainly come from some of those interactions. It can be really, really powerful to acknowledge and verbally say what you're seeing. So as an example, it might be like, "Hi, John, I noticed that ever since I told you about my cancer diagnosis, I haven't been seeing you as much, and I miss you. Is there anything that we can do in our relationship to make this better?" Something along those lines can go really powerful and go really well for patients in reestablishing that connection. When you're in the role of being a caregiver, it can be so all-consuming. You can be constantly worrying about, okay, have I given them enough fluid? Have you given them enough to eat? Are they safe to walk around? Are they on their medications? All of those questions. And the practice of having at least a daily or more frequent check-in with yourself to say, okay, what does my body need right now? What does my emotional state need right now? Taking those couple of moments can be really powerful. And if you do it on a set schedule, you're much more likely to continue with it. So taking those breaks, making sure that you're monitoring your own internal kind of piece. I think the other aspect of being a caregiver that can sometimes make things a little bit harder is that it can feel like it's all on one person. Oftentimes a spouse or a son or daughter of an older patient, but really reaching out for all of the supports that exist to give a caregiver a little bit of respite and time for themselves.